So good afternoon and good evening, everyone. My name's Jordel Akinola, and I'm a community engagement lead within the Equality, Diversity and Inclusion team. And I'm here today to talk about the Patient and Carer Race Equality Framework. So the Patient and Carer Race Equality Framework was NHS England's first ever anti-racism framework. And this is about it's for all NHS trusts across mental health trusts across England, and it's about bringing together race equality and equity. And so it's making sure that trusts prioritise and demonstrate how they're making improvements to show that they're focusing on access, experience and outcomes for racially diverse and ethnically diverse communities. So the Patient and Carer Race Equality Framework is a practical tool to work with communities and understand their priorities. And it's about what steps that trusts can take to achieve practical improvements in reducing racial and cultural bias. And it's about enabling service transformation, which is co-produced and co-created. And it will form part of the Equality Human Rights Commission inspections and also DQC inspections. And it aligns with things such as the NHS Constitution, the NHS Long-Term Plan, the Core 20+5 approach, the Advancing Mental Health Equality Strategy, and also more locally, the North Central London Integrated Care System Population Health Framework. So the Pcref is divided into three components. And the first part is leadership and governance. And this is about having a strong leader at executive level who is overseeing the Pcref in its delivery. And there are also 12 key pieces of legislative and regulatory requirements which impact upon our culturally diverse and ethnically diverse communities that we'll need to focus on. Things such as restrictive practices, the Care Act, deprivation of liberty, all of those acts. So making sure that we're looking at how those impact culturally diverse communities. And then trusts are expected to embed the Pcref into their governance structures so that it's not a standalone thing, it's part of their business as usual. So part two is focusing on organisational competencies. And this is essentially asking, what is a culturally competent trust? And this is about working with local community networks, ethnic-led voluntary sector organisations to identify opportunities to strengthen and purposely deliver on organisational competencies. And this is so that we focus on service transformation so that we're better meeting the needs of our communities. And then part three is the patient and carers feedback mechanism. And this is about improving the way we use data on patient experience and making sure that we're learning from this and that we're feeding this back to our service users and our communities, and that we've got a well-rounded holistic view of how people are feeling and faring when using mental health services. And it's also about demonstrating what's happening and what we're doing and making sure that we're having that impact in reducing racism, discrimination and those racial biases. So part one, leadership and governance. So at the North London Mental Health Partnership, we've embedded the Pcref into our structures on the right. So we'll be having Pcref task and finish groups. We've got a Pcref working group that currently meets monthly and that you're all more than welcome to be invited to. It's an open invitation for our communities as well as our members of staff across the partnership. And then that feeds into our service user and health inequalities work stream. And that goes up to our Equality, Diversity and Inclusion Programme Board. And that also feeds up into our People and Culture Committee and our Partnership Quality and Safety Committee. And that goes right up to our Trust Board. So for part two, organisational competencies, this is essentially asking what a culturally competent trust looks like. And NHS England, when they were working with the early adopter sites and the pilot sites, they came up with these 6 areas. And it is acknowledged that, locally we might have some other priorities that we wish to add to this. So it's not set as just 6. We can add to this depending on our local priorities. But the 6 organisational competencies that they've come up with so far is cultural awareness, staff knowledge and awareness, partnership working, co-production, workforce and co-learning. So for organisational competencies, we'll be required to co-produce and implement actions that will strengthen ourselves as a culturally competent organisation. And this will require us to engage with our voluntary community sector partners, as well as local representatives of our ethnically diverse communities. And as part of this, we'll be required to conduct a self-assessment alongside, as I said, our service user community groups. and to make sure that we've got a baseline measure of how we're performing at the moment, and then to see where we need to improve and how we can make sure that we're strengthening the actions that we've set. So part 3 is the patient in care of feedback mechanism. And this is about understanding people's experiences and using this feedback to drive changes locally. So it's going to be an opportunity to make sure that we're looking at culturally informed outcome measures and getting that agreement from the communities and the service users about what specific measures they'd like us to look at. And then using these measures, as I said, to get a baseline measure of where we are, how we're performing, what gaps there are, but also to help us demonstrate our accountability and ultimately improve experiences of care. And then we'll be embedding these cultural changes of experiences and outcomes as part of the way we deliver our care. We'll also be wanting to make sure that we're making an impact, and part of that is closing the loop. One thing that we're very good at as a trust is looking at data, analysing data, but we're not so good at feeding that back to people. So although we might be making changes, we need to make sure we're letting people know what changes we've made and letting them know that, we understood, we've heard you, and this is what we've done about it. And to make sure that we're more trauma informed, that we're listening to people and really getting a sense of what they're saying to us, what their experiences are, how that's been part of wider societal things, and then what we're doing about it. And then we'll be using this to assess whether the changes that we're making are having that desired impact. So in terms of local priorities for the Pcref, on the left, we've detailed what our data is telling us. So analysing our local data, we can see that we do have overrepresentations under mental health backed detentions, and that's particularly prevalent for our Black community and most highest for our young Black men. And we've also seen that people from Black, Asian, and minority ethnic communities are less likely to access early intervention services until the point of crisis. And they have significantly higher rates of common mental health disorders and severe mental illness. And they've also got poorer experiences when using our services, and then worse outcomes when compared to our non-BAME counterparts. And we've also heard that people would like more support in the community, as well as making sure that they are away from clinical services such as hospital sites. So what has our intelligence indicated? So within our equality, diversity and inclusion team, we've recently compiled a state of inequalities report, and this has highlighted patient experience across our partnership. And there are specific areas that have been identified that need to be taken forward via the Patient and Carer Race Equality Framework. And we've also got our North London Mental Health Partnership 5-year strategy. And again, this has specific deliverables relating to access, experience and outcomes from our culturally diverse and ethnically diverse communities that will need to be taken forward as part of our Pcref. And the North Central London Integrated Care Board also have their outcomes framework and adult mental health delivery plans. And again, this highlights aspects of the Pcref, things to be taken forward via the Pcref. And we've also had some community engagement undertaken locally. And again, this highlighted things such as a lack of awareness, delayed presentation, which then makes people not access us until they come to the point of crisis. And that has impacted on their mental health and wellbeing journey. And then there's also barriers to access, such as not having translation and interpretation services available quickly. And when there have been delays in those services, it then impacts on people's treatment overall. And then we've also had a recent event at the recent community event at Tottenham Stadium. And this was bringing people together to talk about mental health, particularly in our Black and Asian minority ethnic community. And again, this highlighted some of the areas that people wanted to start co-producing for the Pcref. And so we started that, but it's an ongoing journey and making sure that we continue this co-production journey. So I'd now like to introduce and hand over to Rudy, who's our facilitator for Pcref, and he'll be talking us through the next slides. Over to you, Rudy.
Okay, thank you very much, Jordell. And my name is Rudy Page. And in fact, I was one of the facilitators for the national pilot. So there are 4 national pilots over the last couple of years. And so I ran workshops in the community in terms of barbershops, salons, with our faith communities, supported women's groups, and then provided the capacity building for the host organizations, the community organizations, and help develop the development of the role of the what's called Pcref champions. So, and I'm really pleased to be involved with this program, working with Jordell and Jacqueline Morrison, who's our key supporter in the program as well. So just to quickly take you through then, as Jordell said, as it relates to the priorities, so the necessary capacity building of the community organizations around the 6 organizational competencies, but within the community groups and within the community, we will describe them as the 6 pillars. So that's cultural awareness, staff knowledge and awareness, partnership working, co-production, workforce and co-learning. So it's going to be really important for the groups to actually understand the context of this program, in my experience, and to understand where the program's coming from and what the expectations are. So the expectations being that the actual Pcref is one of the key recommendations of the independent review of the mental health, and which was established. This particular review, not just established but described by the review, that the Pcref is a new community-driven organizational competence framework tool and should enable trusts to understand what practical steps they need to take to meet the needs of diverse ethnic communities. So, of course, in order to do that, the community organizations themselves and the communities must understand how that's going to happen. And that's my role to help facilitate that. Now, at the center of the or the reasons for Pcref is the Mental Health Act review, and that was really initiated by the former Prime Minister Theresa May, and the reason being is that the big question was why that they were asked to look at was why there are more people from ethnic minority backgrounds being kept in hospital for their own safety or for the safety of others. So the review is very much about reducing compulsion, and what it set out was some key points that would give individuals more choices in areas such as their treatment, having the right to ask for a second doctor to check if treatment is correct, giving the right to ask for a tribunal, and also an independent advocate. So some of the expectations around delivery for the community groups will be in these areas of advocacy, speaking up on behalf of families, individuals, carers, and explaining to people what their rights are as well. So as you can see, it's going to be a very important program, which will need some capacity building in the communities, as well as Jordell has laid out in the trusts themselves. So I'd just like to stop there then, Jordell, if there's anything to add or any questions. One last thing I should say as well, in the review, they're very clear also about hospitals trying new ways of helping children and young people from African and Caribbean communities. And also it indicated about giving new guidance around helping children, young people and their families, and also helping people with a learning disability and people with autism. So it's quite an extensive range and a much wider group of provision to improve. And I'm particularly glad that Angela is on here because of her work with adult social care as well, which of course will have a significant impact on communities' mental health and carers, and just improved understanding. So one of the key call to action will be for us is to ensure that there's that information, advice and guidance, but more importantly, that from a system point of view, there'll be an improvement in communication, there'll be the improvement around accountability, as Jordell has laid out, and of course, assurance. So there's those three big system aims that relate to being declared a culturally competent trust. Aligned with that has to be co-production and collaboration within the communities themselves and the community organizations. So we've already started to think how we're going to get more and a wider, diverse group of organizations to be part of this initiative. So back to you, Jordell, and then we'll open it up for any other opinions or points.
Great.
Thank you.
Thank you, Rudy. Yeah, and thank you for so eloquently putting how it ties in with the mental health act review and lessons. And absolutely, those key pillars that Rudy spoke about tie in really nicely with what a culturally competent trust is and what they set out in their pilot sites working with NHS England. So yeah, just to go briefly a bit more into what a culturally competent trust is. So the first one, cultural awareness, is about recognising and understanding the diverse backgrounds from the communities that trust serves. And it should include an awareness of the different generational experiences and perspectives and being sensitive to those in providing care. And as a result, being more inclusive. So that's understanding about structural racism, about the history of communities, and even when communities have a long-standing presence, that actually the differences between generations and how they've experienced, for example, trauma is different, and that we need to recognise that and use that to inform how we treat people under our care. The second one, staff knowledge and awareness, is about recognising and, again, understanding the experiences of communities and how we can overcome these biases and prejudices by acting upon them in a positive manner. And then the third one, partnership working. Again, that's about working more closely with our communities, with people in key positions such as yourself, to make sure that we're learning and working together and making sure that we're not doing it in isolation, that we're hearing from your experiences, we're leaning on your expertise and using that to develop a Pcref, which is truly meaningful, representative of the communities, but also have a system working so that we're working together, we're not duplicating, and that we're taking best practice forward and making sure that we're really keeping our community of service users and carers at the heart of everything we do. And so the third, fourth part, co-production, this is about ensuring our ethnically and culturally diverse patients and carers are treated as equal partners in the decision making about their care, treatment plans, and actively involved in the design and development and review of our care pathways across all the stages and all the ages. So making sure we work with our children and young people right up to our older people service users as well. And it's about making sure that they are actively involved at the beginning. Sometimes people say co-production, but they mean consultation when we ask people, but actually it's about genuine co-production, getting people involved in the start at the outset. Number 5 is workforce. And this is about having a culturally competent and diverse workforce that reflects our communities that we serve and that has had a positive impact on our service users. So seeing themselves represented in the workforce and making sure that there's a safe space for our workforce, that we've got champions, inclusive leadership, sharing learning, and intentionally embedding anti-racism approaches. At the moment, the North London Mental Health Partnership has just launched their anti-racism strategy, and the Pcref falls under that. And so we've got the workforce aspect and also the service user aspect. And so we're bringing that together, and it's great that it's got the attention now. It's also tied in with the London People Board anti-racism strategy. So it really is the now time for dealing with racism head on, confronting it, and making sure that our workforce who deliver the care, well, also the community, and who also can be service users, are supported, have a safe environment, and have a culturally competent environment in which to work in.
Good.
And then the sixth one, co-learning. This is a two-way process, and it's about strengthening and sharing the learning, making sure that we focus on what barriers there might be to people accessing culturally appropriate care, and making sure that we're taking active steps to address these things, making sure that we, don't take things for granted, that we do learn, that it's a two-way process, and that we involve our communities in that learning process as well. And so this next slide, so what do we need to do for the Pcref? So it encompasses a lot, but what do we need to do? So we've got Pcref working group, as we said at the beginning, it started. It's a monthly meeting, and it's drawing people from across our 5 partnership boroughs. And what we're doing is we want to understand the priorities for improving access, experience, and outcomes for our culturally and ethnically diverse service users and communities and carers. And this isn't about going out to people saying, what do you want? It's about drawing upon what we already know and adding to this with people's lived experiences who might not be able to have their voices heard, but also what yourselves as our community partners are doing. What are you seeing from your side when you're dealing with people and from your work, you're in the boroughs, your roles, and feeding that together, triangulating that information. And then we'll be developing a partnership Pcref strategy. So again, this is exactly setting out how exactly we want to address the Pcref, how we're taking it forward. In doing that, we'll co-produce what a culturally competent trust looks like based on those competency areas and having good examples of what good looks like for each of those competency areas. We'll then be conducting a self-assessment checklist. So again, we mentioned that earlier, that's about having a baseline measure of where we are and then see where the improvements need to be made. And this will be done in collaboration with our stakeholders, such as yourselves. It's not something that, we're assessing, the assessors are assessing themselves. No, it's something that we're going to be doing in collaboration so that everybody has an equal voice to say. And then once we've co-produced the partnership Pcref plan, this will need to be published on our trust website by March 2025. And as part of the Pcref plan, it will have a clear set of actions and metrics, so things that we're using to measure our progress and make sure that we're delivering meaningful, impactful solutions. So just very briefly, a delivery timeline for the Pcref. So for February at the moment, as I said, we're getting a baseline understanding. So we're building on the knowledge that we have internally with our community, service users, and also our key stakeholders. So again, pulling that all together so we've got a holistic all-round view of people across different stages of the pathways and also in different places in our boroughs. And then we're starting to scope now for the strategy. So again, how we want to take this forward, what areas we'd like to see the changes in, and making sure that aligns with work streams that are mutual to all of us, not just focusing on particularly as a partnership or fundamental health, but also what people want in the communities, if that's what they've said to us that they need. And we'll be doing engagement events, as Rudy said. So we're doing some online, but also in person. And again, this is where we'll be further developing and co-producing what a culturally competent trust looks like. In August, we'll then be aiming to complete our self-assessment in collaboration with our stakeholders. And then by October, this is when we'll want to make sure that we've developed our, starting to flesh out our Pcref strategy and making sure that we've got things in line. And what we'll be doing is making sure that by March, we'll have a Pcref plan with our measures and metrics published and ready to be publicly available. And so in terms of supporting communities and our voluntary community sector, how we'd like to support change locally with a patient impact care or raceability framework, we want to raise the profile of our ethnic-led voluntary community sector grassroots organisations and service providers, because time and time again, you heard that people want ethnically led services such as talking therapies, and they're out there, they're being provided, but it's making sure that we're raising the profile of these services, making sure that we're signposting correctly, and also supporting these organisations to more effectively deliver these services, because often they're constrained and they're not able to flourish. And that's one thing that our Pcref will be supporting. We also want to facilitate more transparency around decision making and service provision. So again, whether that's funding decisions, whether that's who the key delivery partners are, we want to be more transparent and letting communities know how these people have been chosen, how these services will be provided. We also want to continue to increase our partnership working in collaboration. So whether that's strengthening our relationship with our local authority colleagues, police colleagues, local authority colleagues and other, like I said, acute hospital care providers, etc. We're really wanting to make sure that we're strengthening those relationships, because we see people in part of a pathway, but ultimately people are on a journey. They're not just part of a pathway. As I said, we want to make sure we've got better signposting to our VCS and grassroots ethnic-led organisations. And we also want to make sure that we've got more accountability to our partner organisations for how services are being delivered. And we'd also like to influence the grassroots organisations on how they're meeting the needs of the communities. So making sure that, as I said, just to go back to the example, if you've got ethnic-led talking therapy services, we want to make sure that they're having their impacts heard, that the people, the powers that be, the commissioners are hearing the differences that they're making and allowing them to make sure they're properly funded, the resource so that they continue to deliver and meet the needs of the communities. And then the second part is so how we can support you. So again, it's about amplifying the voices of our diverse community members, as us as workers as well, but also members of the community. We've got things to say, and we need to make sure that those things are heard and making sure they're getting right to the top and making sure that we are a collective voice together, because there's power in strength in numbers, and making sure that all of our voices are heard so that we can get to the top, get those changes and not act in isolation. Because one of the things are that, there's lots of great work going on, but actually we need a proper system of ethnically led services, service providers, workforce, and making sure that they are heard and they are having that impact. And the second thing is greater co-production opportunities and shared responsibilities for making improvements. This is not something, the Pcref is not something that we're doing to people, it's doing with people. We're working in partnership. We want that shared responsibility and accountability so that we can hold each other accountable. We're listening to each other, and it's not leaning on one person or one organisation or one group, but we're in this journey together. And then we also want to make sure, as I said, we're closing that feedback loop so that we can improve trust. As I said, people keep saying to us, we've told you this before, what do you do with this information? Well, actually, we want to show people, we want people to see exactly where it's going, exactly what we're doing, so that we're building that trust. And so that people then are confident in us, what we're doing, and how we're working for their benefit and our benefit. Again, making sure that our mutual priorities are being met and we're supporting each other with that. And then enabling communities to advocate for themselves more. And this is such a passion and a key one for me, making sure that we're here as a service, as a network, as a system, but also making sure that people have agency to advocate for themselves, making sure they've got the tools to do this and making sure they're able to navigate pathways. And whether that's making sure we've got resources in alternative languages, making sure that people have guides so they can understand how they're traversing the pathways. It's really about making sure that people have accessible documents so that they can inform themselves and also get help when needed, but that information is there for them. And then finally, increasing people's involvement so that we can implement priorities and making sure that we're letting our communities know how Pcref will support them in navigating this system, because we've got a great opportunity, we've got a great framework at the moment. And actually, it's about letting people know that this is about strengthening your resilience in navigating these pathways, whether that's making sure you're getting the appropriate help early, or once you're in these systems, making sure that you've got the right help that's accessible to you. And so, yeah, in terms of culture and producing a culturally competent trust, as I said, there are lots of things to recognise that we need to do, but ultimately, these are questions that we're putting out to communities, to yourselves. What do we need to make sure that we're recognising, for example, with cultural awareness? We know that there are things going on, but are there specific areas that we want to highlight? So is it that, we really want to make sure that we're highlighting the impact of systemic racism that people experience before they use our services? Is it about making sure that people recognize that actually when they get into systems, they're not just, seen as a black man actually, or a black woman? Actually, I'm a Jamaican woman, I'm a British born woman. What things do we want people to know exactly about us so that they are treating us the way we need to be treated and getting the care we receive? And there's also things such as what evidence should we be considering and monitoring when we're looking at our cultural awareness? And also, what do we need to incorporate into our anti-racist approach? So is it about making sure that we've got clinical practices that are viewed with an anti-racist lens to make sure that actually these things that might be impacting our communities are focused on or towards people's awareness? And then secondly, for things such as staff knowledge and awareness, again, it's about asking and just wanting you to consider, how do we make the necessary improvements? What training should we be improving? Are there particular policies or practices? So, for example, restrictive practices, what should we be doing more in those areas so that we're meeting our needs better? And then how should we use but understanding and racialized experiences to overcome and act on these prejudices. And then thirdly, with partnership working, again, it's about asking how can our services be tailored more, how can we work more closely with our ethnically diverse and culturally diverse communities, so such as our leaders and also lean more to the faith sector, for example. Where do we need to make those improvements? Is it our social care colleagues, for example? Where do we really need to get that support so that we've got wellness and anti-racism embedded in our partnership working? And then questions in terms of co-production, again, wanting to think about, again, how do we ensure that ethnically and culturally diverse service users and carers are treated as equal partners? So do we need to make sure that people are being paid? We've got an involvement register at the moment, but we know actually sometimes that people might want to do things voluntarily for fear of messing up their benefits. So is there another system of payment we need to consider there to enable co-production? And how do we make sure that people are actively involved across all sorts of stages in the care pathway? So is it about making sure people know about meetings, know about service transformation meetings, just thinking about how we can make sure people are involved across all of the transformation and service design process. And then fifthly, for workforce, again, one of the things we want to ask is, again, how do we improve our training standards to make sure we're meeting people's needs? And how do we make sure that, again, we're incorporating this to overcome racial biases? And then a sixth question that we kind of want a bit of feedback and consideration on is co-learning. So with the co-learning, again, it's making sure that we're asking how can our services work more closely with people and making sure that we're embedding this. And just to keep in mind, as I said at the bottom, we've got priorities identified so far. So again, just a reminder, overrepresentation, early intervention, prevention, crisis management in particular, improving access, experience and outcomes, and more support in the community. So yeah, it's just really thinking about how we kind of take those 6 areas and build upon them so that we're then starting to co-produce what a culturally competent trust looks like. So okay, I'll take a break and hand back over to Rudy.
Thank you for that, Jordell. Great presentation, because also what it shows now is a systemic change at the center of this in terms of the policy direction, with clear expectations on delivery and the level of assurance that's going to be required, because it is an accountability framework. And as was mentioned earlier on, why the 6 core competencies, the culturally competencies for the trust, are exactly mirrored with the 6 pillars that the community organizations themselves should understand and be able to share with their own population groups. And of course, in all population groups, you've got the intersectionality that's it we must recognize. And so this is an exciting program. And one of the driving forces is about mental health promotion, which is really important both for the workforce and the community, because one thing we learned post-COVID was the workforce is the community and the community is the workforce. And so mental health promotion is an important communication tool. So you will see with the workshops that we plan for stakeholders and the activities as it relates to advocacy and the greater explanation of the Mental Health Act and the revision of that act and the recommendations of that act that have led to this Pcref. So you can see it's 360 degrees attempt for systemic transformation. So we've got some of our guests on, so I'd like to give them an opportunity. And one last thing I should say, we do understand the importance of academic health research as it relates to this program. One of the elements in the pilot program, not only just I was involved in presentation to the board in terms of the work, the trust board in terms of the work that we've done around Pcref, but also we set out with some recommendations to the National Institute for Health Improvement as well. So there's some great learning and sharing of learning that will go on between the 3 boroughs that that we're responsible for, but of course the 5 boroughs that make up this area. And that will be about sharing the learning across uh, each of the local area plans. And so for each borough, there will be a local action plan. I'd like to open the floor up now. Sandra, I can see you'd like to.
Um, I think someone else has to go first, but I am very encouraged and also completely unaware of the quality of work that's going on to just make this happen. Obviously, when he sent me the information, then I read a lot more around it. I would have loved for some of my academic colleagues in the area of social health or public health to be here. I'm a biochemist, but I am obviously an anti-racism champion. So this applies to all of us, regardless of
Our background.
our work. Yeah, a background. So yes,
Yeah,
I would like to chip in later, but I don't think.
Okay. Well, what I'd say, Sandra, is that we will be running a series of workshops, both online, face to face, with different, as Jordell has indicated, there are different workforce stakeholders, all with an interest in the transformational approach to this work. So there will be an opportunity for that as this rolls out. This is really just the first layout of the overall program, but after this, it will be very targeted and applied to the particular group that we're working. Jacqueline, Angela, and you'd like to come in? Dion is on as well. Just unmute yourself and we just have a dialogue.
Thank you for the invite. This has been going on for a little while, just in terms of the fragmentation. So I come from health and adult social care. So I'm based in Enfield Council. So part of the work that we do, we have got mental health that is an integrated part of the service, and we also have learning disability. But there is quite a high threshold that I'm always told of for people to access mental health services. So the majority of people, they don't quite fit anywhere. So whilst they do come into adult social care, they don't always have their needs met. But it's really important for us all to know what's going on in the community, just so that we can signpost them and also support people. And co-production is one of the areas that I'm working on as well, just increasing that awareness about improving our services. So, I'm grateful for the invite. Thank you.
Excellent. And again, I think Jordell's touched on that in terms of what's good about the Pcref is that at its centre, it is to reconfigure the way community services are delivered. So we do need that experience, and we do need the stories of those individuals who historically may have been excluded because they didn't fit a particular box. This is the opportunity. And again, as I said before, the mental health review is at the centre of this work. And it really set out very clearly what the expectations are going forward. So again, same thing as we said to Sandra, we'd be happy to have a meeting with you and understand more clearly. Jacqueline does a lot of work around that. What are the gaps that people have been falling through before, and we'll address that as part of this program. And that's why, of course, the community organisations themselves will understand as part of their capacity building what those 6 pillars are and what they represent and why they're important and why they also will be expanding the groups that they maybe been dealing with before. But more importantly, we'll be bringing on new providers, maybe individuals who weren't recognised before. Advocacy, again, is at the heart of Pcref. And so yeah, thank you for that, Angela. Sandra?
Yeah, I mean, following on what Angela said and also connecting it to what Jodelle said about co-production, not just consultation. I was just wondering how you make that differentiation. Of course, consultation is important to identify the problem, So what does production look like?
Well, this is a delivery program, so we've got a lot of experience in putting together co-production activities. So and again, it's about that joint decision making and being part of the delivery system. So that's why we talk about the community organisations, understanding what the 6 pillars are, and actually involved in the delivery around the priority areas that have been set out earlier on, and some of the issues that need to be addressed in terms of why those groups were set up in the first place. And they are now at the table and will be contributing to addressing those issues with system support. So the term we use, in terms of Pcref, so Pcref is about community-led, system-enabled, and that's the key thing with this. This is designed for the system itself to enable communities to improve the service. It's from within and beyond. And the beyond means that the co-production is also about collaboration amongst the community organisations themselves and across population groups, because we've learned that that's also a really important way to improve the well-being in neighbourhoods and communities. So let me come to Ernest and then come to you, Jacqueline.
Yeah, okay. My name is Ernest. I work with Diversity Living Services, which is a charity based in Enfield, Morton Green. I think the program is excellent, but I didn't see how you will work with voluntary organizations, especially BME communities. As far as we know, mental health problems are more related to social problems, poverty, migration, how people live in families, and so it's not really medical prescription like tablet or something like that. So we will work with the communities. We know the problems which can affect the mental health. I didn't see what you plan to do with BME communities, and I wanted to see whether you plan a funding program to distribute to BME communities so that they can help you to implement the program and also for co-production. So for now, I can see everything is vague, nothing concrete really how we, the BME community, will be involved in this program.
Well, let me explain to you. Thank you very much, Ernest. So we are inviting you to attend a stakeholder workshop on Monday, May the 13th, 11 a.m. through to 2 p.m. at the Community House on 4th Street in Edmonton, in Enfield. So there you will learn and understand exactly how you can get involved in those areas that you said. And it's important to understand through the 6 pillars how you can be involved. And it is a different approach. And we look forward to seeing you there. And there'll be many more meetings as well. Thank you. Jacqueline, over to you. And then we'll go back to Jordell just to finish off the meeting. Thank you.
Hello, everyone. Hello. And there's really some valuable points made and on all relevant. And there must be great emphasis on the community. Community services is key, and signposting people to the various services within the community, not necessarily the hospital, because that can actually be quite daunting for people. So where possible, if a lot of the services can be signposted within the community is key. And also looking at finances, so social housing, all that sort of thing, actually impacts, as we all know, their mental health. Furthermore, also as well, is that we have to really enforce, be very strong, is looking at cultural diversity and their understanding of cultural diversity, because that's part of the issue. It's not one framework that fits all. So we need really regular reviews of our systems, how they're working, and how we can bring about change. And we can only do that by working closely, collectively with each other and sharing information. So this is a positive way forward for all of us, really, as staff members, as patients, as part of the community, because it impacts us all. Right.
Thank you very much for that, Jacqueline. And before I ask you to close, Jordell, One of the important aspects of this work, and as I said, I worked on the national pilot, but other programs similar, and that is communities working together. So in other words, what we're talking about, the way we put it, is upholding the values of respect and inclusion as a common ground for all, regardless of background, culture, status, or location. So our communities have to also uphold those values, because as we go back into the system and advocating that the system and staff uphold those values, so it must be with the communities. That's something that will be, again, coming through very strongly as we go through the stakeholder and the VCS workshops and master classes. So thank you for that point, Jacqueline, really important. So Jordell, over to you just to close this first meeting. Just like to say again that there will be a workshop Monday the 13th of May at Community House, 11 till 2 in Enfield. Thank you.
Great. Thank you, Rudy. And I just want to say thank you to you all for your really great, valuable contributions. I've written them all down because absolutely you've all hit the nail on the head. It is about signposting, and that's something that we're hearing frequently now. And I think there's some great work that's been going on in terms of, Black systems change. And that's something that actually they're creating a directory of Black services, service providers. And I think absolutely this is something that Pcref can utilise. It can be broken down to different areas. So, what help do you need in Enfield, Haringey? So I think absolutely this is something that we're going to have to work together with. And I actually feel quite proud to be able to do that. There's something that, there's a tool, a vehicle to take forward, something that we're already asking for. And I hate the term quick wins, but actually if there's something in place already, then we can build on that and deliver something meaningful for Pcref. So really excited for that. And sorry, very briefly, Ernest, to your point, it's great to hear about diversity living services in Enfield. And definitely, we have kept this quite vague at this stage because we're very mindful that we don't want to dictate. We do have things that we want to align with. So as I said, we've got a partnership strategy that we want to align with that. We want to align with the integrated care system, but we also want to align with our colleagues in the local authority, in the VCS. So although it does seem quite vague, please don't be put off by that. There is stuff behind the scenes, but at this stage, we want to hear from everybody, give everybody an equal voice, and then see where those alignments are, where they overlay, and where exactly we're strongest and we're weakest, and we need to develop more. So just to reassure you that, if it does sound a bit vague, it's deliberate at the moment, because I said we don't want to dictate, we don't want to say this is what we're doing, because as I said, genuine co-production, we want to co-produce where we take the Pcref. We don't want to say this is what the North London Mental Health Partnership have said they're doing it. You need to come along for that journey. So looking forward to working with you on that. And so thank you for offering. And then also very briefly, Sandra, just going back to your point about co-production versus consultation, absolutely both are necessary. But just co-production is just having people on board at the outset. As I said, listening, being guided by them in equal partnership. It's not 95% us, 5% everybody else. It's that genuine listening to, working with, valuing, and making sure that people are reimbursed for their time as well, especially for our service users and carers. So just making sure they're on board throughout all of the processes and not just cherry picking what we ask them and what information we want from them.
Just finally, people want to get hold of information.
People want to get hold of me. My email address, I might drop it in the chat, but I'll spell it out. It's Jordell, JORDELLE .Akinola, AKINOLA @nhs.net. So please feel free to contact me, and it'd be really great to work with you all. Thank you.
Great. Thank you very much, and good night. Well, and thank you for attending this Pcref Enfield briefing session. Goodbye.